Let's go ahead and get started. So I'll introduce myself. My name is Shanta Jackson, and I am a part of the facilitation team for the Healthy Heart Learning Collaborative, which is a program of the Maryland Department of Health. And today's topic, we're talking about care in between appointments as it relates to cardiovascular disease and, heart health. You all did submit some questions beforehand. And I did send those out, but if at any time you wanted to address those questions, just please advise, just let us know. But before we get started, I would like to know from you all, thinking about yourself and your health and your family, what made you show up tonight?
Well, I'll go. I'm sorry, I'm not on camera tonight. This is Florence Champagne. Because of my own health and because I'm a leader in the industry, but I do have some health issues as well. I have heart disease, coronary artery disease, high blood pressure, and diabetes. So I always like to learn so that I can learn for myself and to disseminate information to others.
Perfect. Thank you for sharing. Anyone else?
Hi, Dr. Champagne. This is my name
Hi,
is Deborah. My name is Deborah Wright. Um,
hi, Deborah.
she's my leader, Dr. Champagne. I just wanted to say I was just recently diagnosed with high blood pressure, and I'm in the process of getting cardiac work and different things. So I just like to learn to find out what's out there. I've learned a lot from Dr. Champagne and her organization, but it's just information you can't lose by gaining more information. So I am excited for this.
Thank you. Thank you so much, Deborah, for sharing. And then we have Dr. Michelle McCoy in the chat. She says, I recently discovered I have some coronary disease issues and I want to learn all that I can. So thank you so much. And Dr. Michelle was here on the first session. And so was Dr. Florence Champagne. She was actually our guest speaker and she talked about calcium scoring. Let's see. Alina Stepp was on during our last session as well. So thank you all for sharing. And again, at any time you can unmute yourselves, raise your hand, or post your questions or comments in the chat. And so at this time, if it's okay with everyone, I will begin and I can share my screen. Okay. Are you all able to see the screen? Okay, perfect. And so welcome to Heart Health Between Appointments, Managing Medications, Daily Care, and Nutrition. Again, I am Shanta Jackson, the facilitator of the Healthy Heart Learning Collaborative. We have 4 peer learning sessions, and this is number 2. I'll share at the end of this session information about our April upcoming session and how to register. Our registration link is always the same. Our guest speaker is Angel V. Shannon. I'll introduce her as well later on in the programming. And just a disclaimer, again, this is a program of the Maryland Department of Health Center for Chronic Disease Prevention and Control. They have a cooperative agreement with the Center for Disease Control and Prevention. And so this is that they have funding from the CDC. And the views expressed do not necessarily reflect the official Maryland Department of Health or CDC policies. And so that was my disclaimer. So again, welcome everyone. So as a reminder, this is a community peer learning space. This is designed for you. We have educational content and we're sharing information, but this is also designed for you all to learn from each other. Everyone's experience is valid and share what you are comfortable sharing, and you may use the chat or speak out loud. And so just a quick overview, the Healthy Heart Learning Collaborative is a statewide learning space. It brings together public health professionals, but then also community members and individuals with lived experiences, caregivers, patients, family members, health and even community partners. And this matters because heart disease is the #1 cause of death in Maryland, and stroke is the 3rd leading cause of death in Maryland. And many of these outcomes can be prevented with early awareness, education, and action. And our goal is to simply support learning, connection, and practical action to prevent heart disease and improve heart health across Maryland. And so at this time, it is my pleasure to introduce Angel V. Shannon. Angel is a board certified nurse practitioner and founder of Seva Health and the Seva Institute. And with nearly 3 decades of experience in chronic disease care, Angel brings an integrative approach to health that combines functional medicine, what is referred to lifestyle medicine, and mind body practices. And this evening, she will share practical guidance on managing heart health between appointments, including medications, daily care routines, and nutrition. And so at this time, please welcome Angel Shannon.
Good evening, everyone. Thank you so much, Shanta, for a beautiful introduction. And thank you all so much for being here tonight. I know that you have many other places you could be and many other things you could be doing, but I think this is one of the best places you can be because it says that you matter. Your heart matters, your health matters, and this is an investment that you'll never, ever regret. Shanta, thank you so much for inviting me. As I had shared with you, Shanta, and as I'll share with our guests tonight, this is a topic that's near and dear to my heart, literally and figuratively. I started my career in intensive care unit medicine, heart health, ICU, trauma, downtown Baltimore, and then have worked in the cardiac cath lab and have been all around town pressing the message forward about why heart health is so important. So I'm really hoping that by the end of this session, we get an understanding of the common challenges with managing your medications, the practical tips that you can take away tonight that you can really put into action. I always say to my own patients, this is about closing the gap between knowing and doing, right? And you need practical tips because we can all read lots of things online, but what matters is what we can put into our own individual practices every day. We're going to talk about a little bit about food that supports heart health alongside your treatment, how to track your symptoms and health numbers, and then when and how to follow up with your healthcare provider. I also have something else very special to share with you that you may or may not have heard of, so I'll save that little surprise for the end. And when I said near and dear to my heart, this is not just what I do professionally, but I've had several relatives who've been diagnosed with a variety of different heart conditions: high blood pressure, coronary artery disease, heart failure, peripheral vascular disease, and it's always landed right, at home for me when I come to talk about this. It's more than just, writing a prescription for a patient, but it's also having had relatives in my life who have had heart conditions, heart health issues. As I'd shared with Shanta, and I do feel comfortable sharing with you this evening, my sister was most recently diagnosed with heart failure, and we've had many challenges moving forward with managing her health. So, as I said, this is very, very near and dear to me, and I'm sharing with you tonight best practices, but also some personal experiences and personal tips that I hope you'll be able to apply. We'll move to the next slide. So let's talk about why between appointment care matters. Because in a nutshell, you get 15 minutes. You get 15 minutes, maybe 20 minutes in any doctor appointment. And why is that? We can talk long time about why those appointments are so short, what that means for you with your care. But for me, what it means is that you have a very narrow amount of time to tell the story of your condition, what's happening outside of that appointment, what stressors you're having. You have a very small window of time, and that time gets smaller and smaller if you're running late, if there's something else going on in the clinic before you've gotten there, if someone didn't check you in on time, if someone before you is getting a life-changing diagnosis, your appointment gets smaller and smaller. So the reason why this really, really matters is because you are your most important patient advocate. You know yourself better than anyone, and the more information you can bring into your appointments, the better. So medications only work if they're taken consistently. We know that. Symptoms can change between visits. Your daily routines support your long-term heart health and early action. This is the point I want to make and drive home. Early action can prevent complications. One of the things I really appreciate about the heart health community is that we are very, very proactive about preventing complications. Heart disease is one of those things that we really, really, really can manage. We've got lots of medications. A lot of them are old medications that have proven to be effective. And if there's any beauty to this that I can say, the beauty is you have so much within your locus of control, the foods you eat, the times you go to bed, managing your stress, exercising. There are many conditions that are outside of our control, but within the heart health sphere of diagnoses, that are many, many things that you can do personally to prevent any complications and then any further complications. And there are lots of different things you can do to track in between your appointments that will make a difference for your healthcare provider who is making decisions about your health. Next slide. So, why are these medications important? This is something that my sister and I talked about early on. Lots of times we come into into a diagnosis of any kind, most of us thinking, I don't want to be on medication. I've never had to take medication before. I shouldn't have to be on medication. I can do this myself. I'm going to just cut back on, my salt, or I'm just going to go to sleep early or do some, meditation. I, all of those things are very, very important. But the reason why medications are so key is something you'll see on that top right side. They reduce strain on the heart. What do we mean by that? They're going to control blood pressure. They're going to reduce cholesterol. They're going to get your heart rhythm in right order. So if you've heard of atrial fibrillation is one of those conditions that you really do want to get that properly under control, because when that heart rate is fibrillating or just, uneven and unsteady, it can lead to the development of blood clots that, if a blood clot travels or gets loose or moves around throughout the body, can lead to stroke, can lead to limb damage. So that's one of those conditions that medication absolutely becomes very, very essential and life-saving. They lower the risk of serious events. And the thing about medications are, if in a provider-based setting, usually the desire is to really prescribe least amount of medication at the lowest dose possible, get conditions under control, and then increase or taper or augment as you go along. So depending on the diagnosis, sometimes there are different medications that a provider may try out and say, let's try this to get this under control, and then augment or add to if need be. It doesn't mean that your lifestyle factors don't matter. It doesn't mean that you're a failure. It doesn't mean anything other than the fact that sometimes a little bit of medication can be the difference between something being stage 1 versus stage 2 versus stage 3, stage 4. And I'm specifically thinking about conditions like heart failure, conditions like hypertension. So medications for the heart, overall, the most important reason that we try to introduce those early when we need to is to reduce strain on the heart. And we know, like anything else, the best medication is the medication that is taken and taken consistently. We'll go to the next slide. So what are some of the medication challenges that I have seen in family and in patients? The biggest thing, taking multiple medications. It is hard to figure out, when should I take this? Should I take this in the morning? Should I take this in the afternoon? Should I take it at bedtime? Do I take things together? If something's supposed to be at, morning, how am I going to remember, or 3 times a day, let's just say, how am I going to remember that second dose? Most people will remember the first dose in the morning with breakfast, the last dose at night before bed, but oh my gosh, I forgot my lunchtime dose because I skipped lunch, right? So forgetting doses is a very, very common problem that we see, or challenge that we see in the community. Side effects. Lots of times there are side effects with medications that people aren't aware of, not knowing that, okay, gosh, my diuretic, the purpose of it is to reduce the amount of fluid buildup, or the amount of fluid, or lower my blood pressure, but gosh, it sure does make me dizzy, or it sure does give me a dry mouth. Sometimes those side effects create significant challenges, and then confusion about what each medication does. And so this is one of the reasons that in my clinical practice, I like to have this conversation earlier rather than later, and starting with just basic education. Why are we prescribing this in the first place? What can you expect? When should you take this medication? What do you do when you forget a dose? Does it mean that you just hurry up and take it and now take 2 at the same time? Not necessarily. All depends. We like to talk about those side effects so that you are aware, because there are side effects to everything, even Tylenol, even Motrin. So awareness is the key about what you can expect. And when I say what you can expect, what we know based on the data, based on the profile of the medication, because everything doesn't affect everybody the same way. And what we really, really want to do is make sure that you understand, as a patient or as a caregiver even, how to dose these appropriately, because everything can't be taken at the same time, we know, and we want to make sure that we have things adequately spaced out. I want to say right off the bat, you see a lot of commercials that will say, ask your doctor. I always say, ask your pharmacist too. One of the people, one person you should always have on your healthcare team with your physician or nurse practitioner is a pharmacist. Always, always remember that your pharmacist has a terminal doctorate degree. They know these medications inside and out better than all of us. Even though we're prescribers, they look at the literature, they know the data, they know what meds have been recalled. They can be a very, very helpful partner on your medical care team. So I always encourage my patients, talk to your pharmacist, get literature from your pharmacist. Always make sure that your pharmacist has an updated profile. So we'll talk a little bit more about that, but I just wanted to make sure that I included that the pharmacist is an essential provider on your healthcare team. We'll go to the next slide. So practical strategies. I'm one who only believes in preaching what I actually practice and practicing what I preach. So I'm going to show you what I have always used for myself and what I always recommend for my patients. Use a pill organizer. Using a pill organizer can help you stay on track. Now, I'm not here to endorse any particular brand or any particular style, but I can say to you from experience in my own family and with my own patients, a pill organizer helps you take your medications at the same time each day. It helps you remember and put them in a sequence that works for you. My particular organizer has morning, afternoon, evening, and then there's a little star for anything that includes my supplements, okay? You want to take your medications at the same time every day as best you can. And we're all going to get distracted. We're all going to lose our way from time to time. Consider using a phone or an alarm reminder, just a little something that says to you, oh, wait a minute, that's my time for my Lasix or time for my blood pressure pill. I cannot emphasize enough how important it is to also keep an updated medication list. Here's the reason why I say that. Because if I'm your primary care provider and I see you and I put you on a medication for your blood pressure, and then you go over to, let's just say, your GYN provider, and that person puts you on, let's just say, an oral contraceptive. Ladies who may be perimenopausal or menopausal sometimes do get prescribed oral contraceptives for different reasons. I may not know that that person prescribed that. I could be prescribing this while someone else is prescribing something else. Let's say you have an orthopedic doctor who says, oh gosh, for your knee pain, just take a little bit of Motrin. If I don't know that, it's going to cause confusion with your medications, and some things just don't pair well together. I always say bring your list to your appointments and always ask questions. I find that having just a little cheat sheet for yourself that just includes what the name of your medication is, what it's for, your dose, how often you take it, what time, and who the doctor is very, very helpful. Okay. And this is something that you can just keep in a notepad. You can get a little notebook at the store and just literally list your medications. If you don't have time to do that, we do something in my office called the brown bag check. Take all of your medications, your actual pill bottles, pop them in a little brown bag, bring them with you to the appointment. So that's a way to make sure that you stay on track, make sure that you are taking what you think you are taking. Sometimes we go in the appointment and we say, oh, I'm taking amlodipine, when it really isn't amlodipine, it's amlodipine dash HCTZ or some other medication. So that little distinction makes a big difference in the appointment. And always ask clarifying questions before you leave those appointments. Always, always, always. Here's another thing people will say to me, well, Angel, if it's only a 15-minute appointment and I don't have any time to ask any questions, ask if there's a patient portal that you can use to drop in some questions. Or schedule a follow-up appointment. Say, this appointment, I had my checkup, but this appointment is for more educational purposes. I have some questions that I need to ask my doctor or my nurse practitioner. You always have the ability to do that. We'll go to the next slide.
Before we go to the next slide, we do have a question. And then
Oh.
also, in addition to asking those clarifying questions, what we talked about in our last peer learning session was, if you don't feel comfortable asking the questions, or if you don't think you can remember, of course, write them down, but also maybe have a patient advocate or someone with you that can help you to ask those questions. And so the question in the chat is, what happens when the medication negatively impacts one's activities of daily living? Example, severe leg or back cramps when walking, then the doctor recommends you to increase exercise.
That's a great question. Severe impact on one's activities of daily living is an immediate red flag. It's an immediate red flag. And sharing that very information that, I'm having, and I had that happen with a patient who was on a statin who had severe leg cramps and had never had those leg cramps before. I said, hey, let's have a look at this medication list. It was a known side effect of one of the statin drugs. And sure enough, we had to switch out the medication. So that's me. Dr. Michelle McCoy said, yeah, and that's an immediate red flag. And most providers, and I'll speak for myself primarily, know that there are so many medications on the market for heart health that patients don't have to suffer with that. We can make modifications. We should make changes. And, you are the most important person on the team. If you're saying you're having a side effect, if there's something that's impacting your daily activities of daily living, automatic red flag, automatic substitution for a different medication. There are more than enough to choose from. That's a great question, Dr. McCoy. Thank you.
Is there an opportunity to ask a pharmacist for recommendations to take back to the doctor to say, hey, these are some other options?
Absolutely. And that's why I said from the very beginning, pharmacists should be on everyone's healthcare team. If you're diagnosed with migraines, if you're diagnosed with a heart condition, a GYN condition, doesn't matter. The minute you get a diagnosis, a pharmacist of any kind, a pharmacist should be a member of your healthcare team. Absolutely. Mhm. So let's talk about this daily monitoring at home. Why is this even important? Because a lot of things happen at home. A lot of things, I mean, you can get to the doctor's office and how's it going, Miss Jones or Mr. Jones? Oh, it's going well, and such and such. And then you remember, oh my goodness, wait a minute, I forgot that, I had some swelling, or I forgot that I felt dizzy, the first thing in the morning. So daily monitoring at home helps you to create a record of things that matter. So, what are the things I think that everyone who has a heart health, a diagnosis that relates to heart disease, what are some of the things I think you should be tracking? Blood pressure, heart rate, weight changes, swelling, dizziness, shortness of breath, medication side effects, and absolutely how you feel overall. I want to say this, lots of times there are some side effects that we don't want to talk about because we don't want to be embarrassed and things like this. Some medications can cause side effects like low libido. They can cause some can cause vaginal dryness. If there are plenty of women tonight, for men who are here, they can cause interfere with libido as well as ejaculation changes. They can cause lots of different changes that impact intimacy in a relationship. Those medication side effects should absolutely be discussed because one of the medications I'm thinking right off the bat is labetalol. And the blood pressure medications in general can interfere with erection, as I said, libido, vaginal dryness with some of the diuretics. So make sure that you are reporting all of the things that you are experiencing, especially when they're new symptoms that you're having after your diagnosis. Weight changes are another big thing. Especially with us ladies, sometimes we will think that, oh gosh, I'm just gaining weight. Oh, it was the holidays, I just put on a couple of pounds. Sometimes those weight changes aren't the result of anything that you're doing wrong with your diet. They can be fluid related weight changes. So we want to make sure we're tracking tracking those weights. This isn't something you need to do every single day, maybe once or twice a week. And when we're talking about weight, we're talking about weight, bare weight. So no clothing, first thing in the morning, just before you're taking your shower or so, hopping on the scale, dry weight as we call it, and putting that in your records. Heart rate and obviously blood pressure, checking at home. I personally always prescribe a blood pressure monitor for my patients. I want anyone who has a heart condition at home, whether it's just blood pressure, coronary artery disease, heart failure, whatever it is. I want you to have that cuff. And if you don't know how to use the cuff or you think you know how and you want to be certain, again, that's something to bring to your appointment with your healthcare provider and just say, hey, I just want to show you how I'm setting this up. I want to make sure I'm doing it correctly at home. Those are things you can absolutely bring into the space of your appointment to make sure that that you're monitoring and measuring properly. Okay, we'll go to the next slide. And why using these logs and journals really, really help. A log is just a log. It doesn't have to be anything fancy. It could be something as simple as a black and white little marble notebook that you used to use when you were in grade school. It can be something that you create on a spreadsheet for yourself. But the reason that this journal practice really, really helps the clinician, it shows us patterns over time. And I'm going to give you an example of heart failure. Heart failure is one of those things that, if not well controlled, does progress to a stage 1, stage 2, stage 3, and then end stage, which is where we don't want to be. But if we see trends, if we see that, gosh, you were 150, 150 pounds, and then gosh, you went up from 150 to 160 in 1 week. Gosh, that's 10 pounds. That could be fluid. right? So we get to see what these trends are over time. It helps us make better decisions. If I see that the weight is going up, I know that maybe we need to get a diuretic on board. Maybe we need to combine these two medications together so that you've got a calcium channel blocker and a fluid pill together. Let's combine these medications. Let's say if you come and you say, oh gosh, I skipped this medication. I forgot you've got 5 days worth of missing your medication. We talk about that and we see, well, maybe you're overwhelmed with all of these medications. Let's try to talk to your pharmacist and combine some things. It makes these appointments much more productive, okay? And it allows you to share your care with your family or caregivers. And as I said, this could be something as simple as a blood pressure log that you create at home. It could be a heart health diary. There are lots of wonderful apps out there nowadays that are inexpensive and or free. It could include even a food journal or a sleep journal. If you're someone who has sleep apnea and your doctor is wanting to make sure that, your condition isn't worsening, a sleep journal is very helpful. And even asking your companion or partner or spouse, how did I sleep last night? Was I snoring? All of these things can be very, very helpful in the clinical setting. When we're making decisions about your health, you are your number one and most important advocate. You are the center of everything that we do. And when we know what's happening at home, we can make better decisions in the clinical appointment. We'll go to the next slide.
Before we move to the next slide, how does this or how can this also apply to individuals who may have comorbidities, meaning more than one health condition, such as, let's say, someone has hypertension and diabetes?
Excellent question. Here again, when we're managing multiple conditions, we need to look at multiple factors. Just because a person works in, let's just say, cardiology, doesn't mean that what's happening with your diabetes isn't important and that it isn't relevant to the care. So having a log of as many of the things that you're monitoring, having that log in place makes a very big difference for our prescribing and our treatment plan. So let's just say the hemoglobin in a diabetic, let's just say the hemoglobin A1C is really high. Let's say we're at the 11 or 10 or 9 range, and that's not well controlled. That only makes the heart condition it can impact the heart. And so that might require us then to change medications. We may want to choose medications that will help diabetes as well as the heart, protect the heart and protect the kidneys all at once. So that means we may look at a combination drug. It absolutely changes everything. So the more that you're able to log and bring in about your whole health, it gives us like a picture. It gives us a painting. It gives us a picture of a bigger view that we're not just looking at your heart, but we're looking at the whole picture and trying to round out your care in a way that makes sense for you. So food as part of daily heart care, one of the biggest challenges is our food systems. In the public health world, we always say that all policy is health policy. So when we talk about food deserts and we talk about, not having access to fresh foods, it impacts every aspect of our life, and it definitely impacts heart health. So one of the biggest ways you can make a significant difference in your heart health is focusing on what's going on the plate. Okay. Doesn't mean that you have to eat, rabbit food all day or lettuce and, salads and whatnot. It just means that there are key things that you want to start eliminating and more key things you want to start including. And why is food so important? Because it works alongside your medications, helps to manage your blood pressure and cholesterol, makes you feel good. When you eat good, you feel good, I think. When you start feeling more energized, eating foods that give you a little bit more energy and don't make you feel so sluggish. Doesn't need to be complicated or perfect, but it absolutely does have a synergistic effect with medications. Now, I know you all can see what I have here is bananas. Bananas are rich in potassium, right? But what happens if you're taking a medication that's potassium sparing? It means that it may cause those potassium levels to be higher. So what I always recommend as part of the team is to work with a dietitian and or a nutritionist, or if you're getting care at a center of heart health where like my sister had her care over at University of Maryland, just mentioning one place, lots and lots and lots of providers and centers are happy to give you recipes. They're happy to give you a list of foods you should include and or avoid. And the beautiful thing now is we also started to include a lot of the restaurant information so that if you go out and you have, get-togethers with family and friends, the things you should be able to look for on those food labels and on those menus and eliminate. And that's one of the biggest culprits is the takeout menus. We'll go to the next slide. So time and energy. I know that's an issue for me. I don't want to speak for anyone here tonight, but I tell you the time and the energy, the budget, the conflicting nutrition advice, the holidays and events, the going out come Friday evening. I don't feel like cooking, so let's look for some takeout. But there's always the challenge of what is on that menu. Things are absolutely loaded in sodium. I would put this out to ask as a poll. You could just answer this quietly in your own mind. What do you think is the recommended amount of sodium for the average adult per day? You can drop it in the chat if you'd like. The recommended milligrams of sodium per day for the average adult. So we try in cardiac and heart health to stay under the 1800 milligram range, maybe even lower than that, depending on whether we're talking about or uh, heart failure or hypertension or so. I was out at a restaurant recently and was mortified that one thing on the plate on the menu that I was going to order was almost 3,000 milligrams of sodium. So I can't say it enough. Read those labels and planning is what helps us be successful. If you can get in a circle of individuals who are try to stay under 1800. Yes, 1800 milligrams. Try to get in meal prep and meal planning circles. There are lots and lots and lots of resources to help you stay in budget and really preserve your time and energy in planning healthy meals. We'll go to the next slide. So what are the things we know? We want to round out that plate. We want some balance on the plate. We know fruits and vegetables, whole grains, prioritizing proteins. But one of the biggest things I like to say is think the added sugars are not something people often think about with heart health. When we think about sugar, we're often thinking about diabetes, but sugars are just as big a culprit as salt when it comes to heart health. You want to get those omega-3s on board and fresh herbs and spices. I can't sing their praises enough. I absolutely can tell you that over time, changing your palate with fresh herbs and spices will go a long way. A lot of information can be found by Googling culinary medicine. If you Google culinary medicine for heart health, there are lots and lots of articles and great reads on the medicinal qualities of herbs and many, many of the world's spices that are known to help lower blood pressure, things like ginger and things like rosemary, things like thyme. Fresh spices have very unique medicinal qualities that you would actually find quite fascinating, and they just taste good too. We'll do next slide. So the plate method, half a plate of veggies. You can never overdose on veggies. No one has ever gone to the hospital because of eating too many good veggies. And I say that, just sort of jokingly. Of course, you have to not eat things that you would be allergic to, obviously. But my point is that veggies, okay? Half of the plate of veggies, a quarter of the plate of lean protein, quarter of fiber-rich grains. And that's literally just a round plate divided in half. So one half with the veggies, and then top quarter of your protein, bottom quarter of your fiber-rich grains. You want to stick to those things that are whole grains like brown rice, the oats, the whole wheat bread. And I love, love, love the protein. Protein is just, especially as we get older, and I will say ladies who are perimenopausal or menopausal, proteins become very, very important source of energy, particularly if you're dealing with the brain fog that's often associated with changes in the blood sugar levels that come as a result of the lack of estrogen. So estrogen, our loss of estrogen impacts blood glucose levels. Blood glucose levels that go up and down can give you that sort of brain foggy feeling. Proteins are a very rich source of energy. So I always ask my patients to prioritize protein on the plate. Very important for heart health. You obviously want to be limiting that salt or sodium by cooking more at home. And as I say, even if you're cooking at home, just check those labels. You'd be surprised how much sodium is in almost everything. Mayonnaise, mustard. When you get online and you Google that culinary medicine, which is something I'm focusing more on, you will be surprised how many things that you're able to make at home, dressings and things like this. Reducing those sugary drinks, obviously eating no highly processed foods like fast food and chips to the best of your ability, eliminating those. And then you want to plan early and accordingly for holidays and events. I oftentimes have a little workshop for my patients on how to manage the holiday events, especially around the holidays. You don't want to be the one who's always saying, no, I can't make it, but how you can plan ahead of time and what some kind of language that you can use to convey to your family and friends that, I'm sorry, I'm not going to be able to participate in that. And then what you can do if you do participate, how you can honor your own heart and your own health in a good way, in such a way that you're not offending anyone or missing out on family events. We'll go to the next slide. And one thing I wanted to sort of surprise you with, if anyone knows what heart math is, please do drop it in the chat if you're familiar with it. But heart math is something I am very, very deeply passionate about and just have been vigilant about it with my patient population. This is a little sensor, and I'm just going to show you a real one here. This is my own personal one that I carry. Heart math is a tool that we have been using for the past maybe 25 years through the Heart Math Institute. And what it does is it helps us measure our own heart rate variability and patterns. So if you've ever been to the doctor and you've had your EKG done and you see you've got that little blip and then the up and down and then another little blip, what it shows us is the amount of time and space between the heartbeats, okay? It's a biofeedback system, basically. And it's helping you decode the language between your heart and your brain, your emotions that impact how you feel and perform. So let me give you an example. Let's just say you have a meeting and you know you're going to be meeting with John and Susie. And Susie's one person who's always really high energy and always organized and gets through the meeting. And John is, really pumped up and you're just feeling really anxious about this meeting. Well, chances are, if you were to put your finger on your pulse, you probably could feel your heart picking up, your heart rate picking up. The HRV score for that level of stress is probably going to be on the low side because you're feeling anxious or nervous. Let's just say you got to get home and talk to one of your kids. You got something in the mail that maybe their grades aren't as good as you thought. That's going to be causing anxiety, right? So when we're anxious, we have activation of what's called your sympathetic nervous system. Sympathetic nervous system increases your blood pressure, increases your heart rate, and it lowers your heart rate variability score. So this little tool here is a really helpful thing that you just clip onto your ear. It's non-invasive. We've been using it at the Heart Math Institute for over 20 years, as I said, 25 years. And it just has a little button that you click on here. It connects to your own Wi-Fi on your phone. There's an app that comes along with it. And as you can see on the screen, you get to see and pick up what your heart rate variability score is. Now, what do you do with that information? Well, you train yourself to improve that heart rate variability through breathwork exercises, through specific mind-body practices. Okay. It helps you understand and tap into your emotions, which increase your heart coherence and improve HRV. Basically, in a nutshell, what are you saying, Angel? It helps you to relax, helps you to tune into your own heart rate, your own heart rhythm, your own breathing pattern. And when you train with specific breathing practices, you're able to calm down that sympathetic nervous system. Heart math has been used in mental health practices, heart health practices. It's been used in the space of oncology. It's been used in those who are at the end stage of life, and and many, many different areas of preventive health. I personally use this in between appointments. I use this when I'm flying. I used it first thing in the morning just to get myself centered. It's one of those mind-body stress reduction tools that I highly recommend in my own clinical practice. And you may have heard of MSBR, MBSR, mindfulness-based stress reduction. That is another tool that I highly, highly recommend. It's not the same as heart math, but it's similar in the sense that it helps you connect emotion to physical body. So heart rhythm, heart HRV scores, and things like this. Highly, highly recommend this, especially for my ladies who are experiencing perimenopause, menopause, on top of heart health issues and on top of other chronic health conditions. I can't speak enough about what a difference it has made for my patients as well as for myself. Let's see. Do we have another slide, Shanta?
So let's see. So before you go on, Reverend Etna Jenkins, when you were describing the meeting between John and Susie and the anxiety, she was saying that she feels this way right now, that she's experiencing this right now. And then also,
I'm
and so
sorry.
yeah, so thank you for sharing that, Reverend Jenkins, and the mindfulness, the breathing, and I think that was it's timely. But then also you mentioned, women and hormones. I do know that some males, so for example, when you're speaking of oncology cancer, for example, prostate cancer, it feeds off of testosterone.
Yes.
And so some men may take medication to lower their testosterone. So some of the same feelings that a woman would experience with lower estrogen and some of those hormonal levels and the heart rate, the anxiety, it can happen to men too. So I just wanted to throw that out there, just because we do have men on the call as well on the.
Absolutely. And that, thank you for bringing that up. Very, very important point that absolutely andropause impacts men in the same way that menopause impacts women. And yes, we can actually develop cardiac symptoms as a result of menopause, very low testosterone levels, and that loss of estrogen in perimenopause and menopause. Absolutely. Thank you for bringing that point up, Shanta.
Our closing slide, and then we can open it up for questions.
Absolutely. So when to follow up with your provider? Always, always, always. When you're experiencing new or worsening symptoms, don't be shy about it. Anything that you think that I don't remember feeling this way, bring it into the clinical setting. Very high or very low heart rate or blood pressure readings, always make sure that your provider has given you a parameter that you should be staying within. So if they want you between 120 and over 70, between that and something else, then be sure that you're reporting when you are outside of that range. Medication side effects, do not be shy about mentioning what those side effects are, even something as quote unquote simple as dry mouth. It can be a sign of dehydration. You want any trouble that you're having taking medications as prescribed or new medications from other providers, or I'll even add any financial difficulty. If your copays have changed, if this is not on tier 1 or tier 2 anymore, any trouble that you're having with medications, you want to report that right away, even if you're having trouble accessing them. If the pharmacy says that, oh gosh, we're out of stock, we're not going to have that for another 2 weeks, you want to make sure that you're bringing that to the attention of your healthcare provider. And any questions or concerns you're unsure about, don't be shy. You are never, 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 ever going to ask the wrong question or a silly question. The most important question is the question that you have for your health and well-being. And it's all about you. You are the center of your care. So please, please, please don't ever feel like there's any silly question. And any question that you've already asked and they answered, and now you have to ask it again, please ask it again. So I hope that this has been helpful for you. And Shanta, I guess we can open up for questions.
Yes, but before we do that, I'm going to take you to our key takeaways just in case. So heart health happens every day, not just the appointment. Consistency matters more than perfection. Tools like logs and journals can help. Food supports heart health alongside treatment, and speak up and follow up when something feels off. Um, then also the 1800 milligrams of sodium, you want to kind of stay under that. That should be your goal. And then also we will share with you a link for evaluation in the chat and via email. And if you could please complete that survey. And we actually do have a blood pressure log that we would if you complete the evaluation survey and you express interest in the evaluation survey. So this goes to the first 15 participants who complete the evaluation survey. We will send you that wellness planner. And so back to the questions and discussion. What questions do you have? What stood out most to you? Are there any strategies that have helped you? Or what will you try after tonight?
I found this very helpful. I have a 57-year-old daughter who has high blood pressure and has been elevated. I was ill during December and January, and that's what she blames it on. But she's also post-perimenopausal, and so I was wondering, does your provider have to the device you put on your ear and the monitors, does it have to be, can you just buy it over the counter? Does your provider have to recommend it, or what? How can somebody obtain it?
Great question, Miss Jenkins, and thank you so much for sharing that. The beautiful thing about Heart Math, you don't need a prescription for it. You can purchase it yourself individually. Sometimes your flexible spending can be applied. Use flexible spending because if you have a diagnosis or someone has a diagnosis of a heart condition or any other health condition, usually that can be substantiated as a flexible spending expense. So I can provide Shanta with the link to where you can learn more about it. And certainly it's something that you can purchase yourself.
Yes.
Thank you.
Something you need a prescription for. Mhm.
Thank you. So the resources that were shared and recommended by Angel Shannon, we will follow up with information like a resource list. And so we have our next question, Dr. Michelle McCoy, and then Dr. Florence Champagne.
Thank you. I believe a lot of this information was great. My only question is, and I like the way you encouraged us to continue to advocate for our healthcare needs. I did put in the chat, but I'll share with it. I am advocating for my healthcare needs. I've shared with my doctor that some new medications he's put me on are causing those cramping. And then I put in the chat about how my blood pressure has dropped. I had a blood pressure like average about 140 over 70. They put me on, and my heart rate was a little higher, like 88, 90. He put me on this blood pressure medication that lowered my blood pressure down to like maybe 110 over 20. And when I would tell him, and then my heart rate like 95, 99 at rest, and I tell the physician's assistant how it was making me feel dizzy because I'm walking my dogs and I'm like feel like I'm about to pass out. I had to lay on a tree. So I'm saying how it was impacting my activities of daily living. So what do you do when they say it's normal? Oh, that's in the normal range. When you tell them, yes, it's lower than what it was, 110 over whatever. But for me, with my age, I'm like, I'm not a runner or a track star. Right. So I'm like, so why is so I'm trying to advocate. There's still not making any changes. So,
Absolutely. And what I'm hearing is the difficulty with being heard and validated in your experience. And that is a common challenge. What I often say to my patients is when they're advocating for themselves, I generally say, keep a record of what's happening. Okay, this happened this time, this happened this time, this happened. And then the language I tend to use is, and even for myself, this has happened more than once. This is how it's impacting my life. Can you show me what the recommended guidelines are for blood pressure management in my age range? Most of the times when you ask for the guidelines, the person who you're talking to knows that you've done your research, you've done your reading. You want to see where in the guidelines is it that I should have a blood pressure? What's the range that a person should have? Maybe even bringing in your pharmacist, as Shanta was saying earlier. You know, doctor such and such, I spoke with my pharmacist about this. I'm concerned because I'm feeling this way. And we both were talking about maybe it's time that I should change my medication. I say this, the best healthcare provider is the provider who listens. I don't ever tell people who they should and shouldn't see, but I do feel very strongly that every person should be heard and feel validated before they leave the appointment. If they don't feel fully heard and validated, that means we need to make a follow-up appointment so that they can be heard and validated. So sometimes, as I said, bringing in that pharmacist to say, you know, I'm having this, is this a normal side effect? Getting that information and then saying, you know, can you show me what the new guidelines are for heart health? Because I'm very curious what the target range should be for blood pressure in my age bracket. And I'm glad that you mentioned that, Dr. McCoy, because surely as we get older, sometimes we don't need really, really low blood pressures because it can lead to that feeling of feeling faint and dizzy. hmm
Perfect. Thank you. So as a
thank
reminder,
you.
You're
yes,
welcome.
we are at time. We're not closing now. I just wanted to just acknowledge the time. And for those who can't stay, we understand, but we're still here to answer the questions. So Dr. Florence Champagne, and then we have a question from Lena Stepp in the chat.
Yes.
Yes, thank you. Thank you so much for this presentation, Dr. McCoy. So you touched on the tiers of medication. Can you elaborate on that just a little bit? And also, I wanted to know, are there always substitutes for medications? For example, if the doctor prescribes something, I go to the pharmacist and my copay is so high for that particular medication.
Mhm.
And then I'm kind of stuck because I don't know exactly if there is a substitute. I've been told, oh, this manufacturer is the only one that makes this particular drug. So then we're just like stuck. So could you talk a little bit about that?
Absolutely. Having a background in insurance, I can say this definitively. First, the question about the tiers. Tiers are how the insurance company gauges the payment for the drug, right? And then what they consider, they look at something called evidence-based data. So we know that, let's just say, calcium channel blockers, this class of drugs is recommended by the American Cardiology Association as being the leading, the most important drug a person should be on when they're diagnosed with hypertension. Let's just say that hypothetically. Based on the evidence, these drugs will be considered tier one. These are tier two, tier three. Tier just means where they fall along the payment scale, okay, or the reimbursement scale, if you will. So, based on your particular drug plan, drug coverage plan, and you'll know this by talking to your insurance company, is this a tier one, tier two, tier three? Tier one may mean if the drug is $50, they'll pay $40. And you pay 10. Tier two may be, they'll pay $30 and you pay 20. It all has to do with payment. That's number one. And it all has to do with the evidence and the clinical guidelines. So they try to tier those things according to the guidelines as to what is the most effective drug for this particular diagnosis and whatnot. So that has to do with payment. Now, when it comes to your actual prescription and you go to the doctor or the pharmacy to get your medication, and it turns out that you have a high copay or such, for most medications, there is another drug in the same class that can do the same thing, unless it is a brand new drug that has not yet been passed over into the generic line. So if there's no generic, if this is a brand new drug, if it hasn't been released into, as I said, the generic form, then you could be quote unquote stuck. But the thing about heart health and most medications, I don't want to say all, but most of your older medications, there are generics to them. So, you can get a cheaper, not cheaper, a less expensive drug. This is where you want to tap into the pharmacist. Don't, all of these commercials that say, ask your doctor, I always say, ask your pharmacist. They are your direct pipeline to the insurance company. They know what the tiers are. They know what the reimbursement usually is. They can run it through. They can do interaction checkers for you. They can do a lot. They are just so severely underutilized in healthcare. It just hurts my heart sometimes. So this is where you go straight to the pharmacist. This copay is such and such. Please give me a list of medications that I can take to my next doctor appointment and ask about switching out. Does that make sense?
Absolutely. Great advice. Thank you.
You're welcome. You're
We have
welcome.
one final question, but before we move on, also your pharmacist may have information about like any coupons or discounts as it relates to medication as well. And
Yes.
so our final question is from Lena Stepp. Was diagnosed with first degree heart block, used to run years ago, being followed by a cardiologist and electrophysiologist.
Mhm. Yes.
Can you hear me?
Yes.
Yes, I'll be
We
quick
can
because I know we're at the end. Thank you so much. This is awesome. And hi, Shante. Good to see you again, Miss Jackson. Thank you so much. Quick question. I just want to make sure that I'm actually on the right path. I've had 3 Zio patches. I've been tested for sleep apnea because my heart rate drops when I sleep. My heart went down to actually, I think it was 39 or something like that during my sleep. So I'm asymptomatic. I don't have any symptoms. My cardiologist said that if I became symptomatic, then they're looking mostly towards like a pacemaker or something like that. But right now, they're not, I'm healthy right now. They're not anticipating that. But I just want to make sure that I'm on the right path, because when I used to work in the ICU, I used to put myself on the monitor and I knew what rhythm I was in. I was in first degree AV block, but it's type 1. It's not 2. It hasn't been over to 2 or 3 yet. So am I on the right path for just like, see how this plays out as I get older?
Well, I can't give any medical advice, but what I can say is that a cardiologist and the electrophysiologist are the two people on the two most important people you want to keep your appointments with, because that is the role of the electrophysiologist, is to make sure that your heart rate is normal, that it is within the range that you need it, so that everyone functions at a different level. Some people need to feel at 80 beats a minute to feel energized, or things like this. So they're going to keep a great eye on the rhythm, the rate, symptoms that you're having, and those two professionals should be working hand in hand together, your cardiologist and electrophysiologist. And I'm glad you asked this question, because they are usually two very separate disciplines. Cardiology does one thing, EP, or we call them EP, or electrophysiologists, they really do tightly focus on the devices, like the pacemakers, and then also the life vests and things like that. So it sounds like you're in really good hands, and it sounds like you'll one of these days be blowing out 100 candles. But yes, those two are your most important professionals for managing what you are referring to.
Thank you very much.
You're welcome.
And thank you, everyone. It was a slide that I wanted to share with you. Okay, so again, the evaluation survey, we will send out the blood pressure logbook if you select that in the evaluation. The link to register For all of the Healthy Heart Pure Learning sessions is the same. That's the QR code. The next one is on Tuesday, April 7th, and it's about planning ahead before your health. Planning ahead for your health, making decisions before a crisis. And so our featured speakers, we have someone from the Maryland Advanced Directive Program, and they'll talk about advanced directives and the free service that's available through the state and how you can complete that, have that on file for your provider and for your family. And then also we'll have an attorney from the Maryland Volunteer Lawyer Service, and he'll talk more about things such as like estate planning, wills, trusts, power of attorney, different things like that. So please do be prepared to come with your questions for those professionals, and that's our next session on Tuesday, April 7th at 6 p.m. Thank you everyone for joining us today. Be safe, be blessed. Thank you so much.
Thank you, everyone. Have a good evening.
Thanks.